This meeting is being recorded.
Okay, good morning, everyone. Welcome to the second day of our January 27th and 28th meeting. My name is Greg Lippy. I'm president of the board. As we resume our meeting today, I remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. This meeting is being conducted consistent with the provisions of Governor Gavin Newsom's Executive Order N-2920. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. I will announce when we are accepting public comment. I have advised the moderator to allot 2 minutes to each individual providing comments. As a reminder for members of the public that wish to participate, I will ask the moderator to provide general instructions. Moderator, please go ahead.
Good morning, this is the moderator. We will be utilizing the question and answer feature in WebEx for processing of public requests for comment. When the president requests public comment, we will open what we call the Q&A panel. You will locate the Q&A icon on your screen and click on that. Then you can type, "I would like to make a comment," into the text field and submit that to all panelists. We will be taking public comments in the order that they are received. As President Lippy mentioned, you will have 2 minutes to make your public comment. I will provide a 10-second reminder before your time has expired. When I open your microphone, I will announce that your line is open and announce that you have the 2 minutes. Once your 2 minutes has expired, I will again mute your microphone and move on to the next public commenter, and second round comments are not allowed at this time. Thank you, President Lippy, and the floor is back to you.
Thank you.
Excuse me, moderator. This is Maria Serpa. I'm not seeing your screen. Are we displaying anything?
We are.
Is it just me?
Are you connected, computer, phone, tablet?
I was seeing it earlier. I'm just wondering if the rest of the group is.
Yeah, Maria, we can see it.
Okay. I apologize for the interruption. I'll fix myself.
Okay.
Okay, thank you. I'll now take a roll call to establish a quorum. Members, as I call your name, please remember to unmute before speaking. Ryan Brooks.
Here, Mr. President.
Thank you. Cheryl Butler.
Good morning, Mr. President.
Good morning. Thank you. Shirley Kim.
He was there.
Shirley, I know, but I need her to speak. I guess she's having a little problem with her mic. All right, let's go on to Sung Oh. I'll come back. Sung?
Good morning.
Good morning. Thank you. Jig?
Good morning, President Lippy.
Good morning. Good to have you back. Ricardo Sanchez.
Here.
Thank you, Ricardo. Maria Serpa.
I'm here, and I also see the screens now. Thank you.
Great. Thank you, Maria. Debbie Veal.
Here. Good morning.
Good morning. Jason Weiss.
Good morning, everybody.
Good morning. Albert Wong.
Good morning, everyone.
Good morning. I'll come back. Shirley Kim.
President, if you'd like, I will unmute her microphone to see if maybe she's having
Yes.
challenges with that.
Please.
Touch points, and then, if
Sounds like she might be on another conversation.
Okay, well, we have a quorum established, so that's okay. Let's go ahead. Okay. Now that the quorum is established, I'm going to turn the meeting over to Debbie Veal, Chairperson of the Licensing Committee. Debbie, it's all yours.
Thank you, Mr. President. The licensing committee actually met yesterday morning, and so I'm going to go through our committee report and add in the action items that occurred yesterday. Just Agenda item A is a presentation by the University of California Schools of Pharmacy related to academic dishonesty. And as you may recall, in the past, we have received a presentation or published research regarding academic dishonesty in California Schools of Pharmacy that was actually done by a group of pharmacy students. And then in the licensing committee meeting in October 2020, our committee actually discussed this again and decided that we wanted to, continue the discussion and see what other information we could obtain. And so what we had yesterday was actually an outstanding presentation by UCSD and UCSF, the deans and other members of the staff about their academic dishonesty definition and policy. In the meeting materials, I believe, is a copy of their policy. And I guess, there was really no action items that came out of that, but, well, actually, there was one action item. Dr. Guglielmo from UCSF School of Pharmacy offered to help us kind of benchmark what is the common definition of academic dishonesty for the schools in California, because once again, this is just two of the schools talking, and they're both public schools. They did mention that their policy was very similar. Their definitions and policies were very similar, but they weren't sure if that would be true with the other 12 schools. And in addition, benchmarking the process for what happens in each school should dishonesty occur. And dishonesty for them was responsibility of both the student and the professor, the academia, and it included, everything I think we've talked about in the past. So it included, copying work, looking at someone else's test, but also it did include one of the things that we are most concerned about, and that is sharing test questions with other students. So just kind of at a very high level, that is, that was, the comments that came out. We did also touch on what happens if a student is disciplined within the school. Are they notified? Is the board notified? And basically the answer is no. The only time the board is notified is if a student is disenrolled from the school for whatever reason. And, we learned that basically we don't know the reason. But we are informed that they have disenrolled in the school, because that would be, one of the conditions of having an intern license, so that we could, adjust their intern license status. But right now, we are not informed if academic dishonesty was part of the reason why they are disenrolled. In addition, at a prior, I don't know if it was a committee meeting or a board meeting, there was a comment made that perhaps on the transcripts of the California public schools that there is something that they do report dishonesty. So we did ask about that, and that information is not passed to the board. Like when we ask for transcripts when a candidate is applying for the pharmacist license, we do get transcripts, but that is not what's included. What is not what is sent to us, that piece of information. So bottom line is right now we do not know if the student has had any academic dishonesty issues. The main follow-up item is at least we felt like a good next step was to get at least all the universities and college schools of pharmacy in the state aligned on what is the definition, and somewhat at least benchmark, understand what their process is should dishonesty be detected or reported. I will stop, and let me first ask if there's any committee members, if there's anything you want to add to my summary. Okay. Is there any questions from the other board members? Okay, moderator, can we open up the line for any kind of public comment?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, "I would like to make a comment" into the Ask field and submit that to all panelists. We will now pause for a brief moment.
Okay, moderator, it looks like we have a quiet crowd.
We do today. I will close the panel.
We had a very, the stakeholders were very involved in our meeting yesterday, so that was, it was nice to have a lot of feedback. Moderator, you can close the public comment. I'm going to move on to item B in the committee report, which is discussion and consideration of statutory proposal to expand the authority for pharmacists to order and administer CLIA waive tests for influenza and COVID. Before I even start this section, I just want to acknowledge that there was a request both by the committee members as well as the public that in the future they would like this item expanded, and so it will be on a future agenda item, and that is to look at all CLIA waive tests, with the pharmacist being able to order and administer all CLIA waive tests, as well as look into technicians being able to assist the pharmacist in that effort. So just kind of want to let you know up front that that was a comment that came up a couple times, and it will be on a future agenda item. So in the meeting material is a lot of relevant law that I'm not going to go through. Once again, our agenda item is to talk about pharmacists only to order the CLIA waive test, and specifically only the influenza and COVID test. So in just as the background, in August 25, 2020, the DCA director issued an order that waives specified professional licensing requirement and amends the scope of practice for pharmacists and pharmacy technicians to allow them to perform waived point-of-care testing to detect the SARS virus. Along with the waiver, the guidance was released to inform and educate our pharmacists and technicians of clinical laboratory requirements that apply under this order. At our last meeting, the board approved a policy statement around providing the CLIA waive test, which included not only a policy statement that we supported, but also in the policy statement, it says that a more permanent solution through statutory change to facilitate pharmacists to perform CLIA waive COVID and influenza testing in a safe manner would be pursued by the committee. So that was our charge during this during our committee meeting, was to work on statutory language. Now, I would like to, just give me one second. What we did is we broke down the proposed draft statutory language, and took it in basically 3 sections. We just felt like that was going to be the easiest way to address it. So the first section as a committee that we looked at is, excuse me, I'm trying to pull it up real quick here. I thought I had the page, but I didn't. Just give me one second. I apologize. I didn't have this preloaded on my computer. So the first section is BPC code 4052.4. And if you look in your meeting materials, you'll see in that section we added section B, and I'm going to read, and as a committee we modified this slightly. It's going to say something to the effect of, and we did give the executive officer the ability to massage a little bit this first sentence, but the intent of the first sentence is a pharmacist may perform any aspect of any FDA-approved or authorized point-of-care test for the presence of the SARS-CoV-2 or influenza that are classified as waived pursuant to the federal clinical lab improvement amendments as described under the following conditions. So the first condition in your materials is what we've modified slightly. It will say the pharmacist completes the testing as is appropriately licensed in California as a laboratory pursuant to BPC code 1265. So basically we took out the sentence or the phrase that said it had to happen in a pharmacy because there was a lot of discussion on the board as well as the stakeholders that testing does not always happen in the pharmacy. Number 2 is the pharmacist has completed necessary training as specified in the pharmacy's policies and procedures. So that was the first piece that we looked at. We received quite a bit of a comment, and our specific motion was to accept the proposal with the removal of in pharmacy and give the executive officer the authority to make non-substantive changes. So that's the recommended motion by the committee to the board regarding section 4052.4B1. And since it's a motion by the committee, I do not need a second. But I will open it up to see if there's any committee members that would like to make any additional comments around the discussion on this section. Okay, hearing none, are there any board members that have any questions about our discussion or the change we made or why we're specifically adding this to 4052.4? Hearing none, moderator, I would like for you to open up the line for public comment.
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, we are displaying instructions on the screen for your reference. Please click on the Q&A icon on your screen, type "I would like to make a comment" into the Ask field, and submit that to all panelists. Our first request for comment comes from Lindsay Golohorn. Lindsay, your line is open and you will have 2 minutes.
Thank you. Good morning, President Lippy and board members. This is Lindsay Golohorn with the California Retailers Association and the National Association of Chain Drugstores. I just want to reiterate our support for this proposal as drafted from Licensing Committee, and we appreciate the discussion yesterday. Also do want to note that we support adding pharmacy technicians to this proposal consistent with the DCA waiver. However, we do want to register our support for the proposal before you today. Thank you.
Our next request for comment comes from Daniel Robinson. Daniel, your line is open and you will have 2 minutes.
Thank you. I'm Dan Robinson, Dean of the College of Pharmacy at Western University of Health Sciences. You know, as we review and amend Business and Professions Code, we need to realize that much of the existing language was implemented before the legislature declared pharmacists as healthcare providers who have the authority to provide healthcare services. So rather than adding additional layers of rules and regulations, we need to rethink the entirety of Chapter 9 and claim our place as healthcare providers. The amendments that were mentioned, 4052.4 and 4119.10, related to COVID-19, would see no corresponding change in the Medical Practice Act, because changes in medicine and healthcare are inevitable and constant. As healthcare providers, practice will change as knowledge and science change, and our services as pharmacists need to be based on prevailing standard of care. A simple statement regarding immunization, such as authority extends to vaccines approved by the FDA under emergency use authorization, would eliminate the need to specifically make changes to the Business and Professions Code related to COVID-19 or any subsequent variants or any other pandemic that might happen in the future. Pharmacists already have independent authority to administer and provide vaccines. So just adding, extending authority for under emergency use authorization would eliminate any of these changes related to new viruses or vaccines that would be developed. Thank you.
Thank you, Dean Robinson.
Our next go ahead.
Just before we have the next speaker, I just want to clarify. This particular motion is around testing and not vaccines. And as we mentioned yesterday, vaccines were addressed in our last meeting, and the board has expanded the scope for pharmacists, or our plan is to, in statute, expand the scope for vaccines. So we are in agreement with you, Dean, and I think already heading down that road.
Our next comment comes from Keith Yoshizuka. Keith, your line is open and you will have 2 minutes.
This is Keith Yoshizuka, president of the California Society of Health System Pharmacists, speaking on behalf of CSHP. I speak in support of the proposed statutory change to make permanent the pharmacist's ability to do testing. I further applaud the Board of Pharmacy for having the vision to incorporate pharmacists into the overall protection of public health for the residents of California. And we look forward to working with the Board of Pharmacy in the possible expansion of tests in the future for CLIA waive tests. Thank you.
Thank you.
Our next comment comes from Mark Johnston. Mark, your line is open and you will have 2 minutes.
Thank you, Mark Johnston, CVS Health. Thank you, board, for this draft change, including the striking of in a pharmacy. I did want to point out that only 3 states limit the tests, the CLIA waive tests that a pharmacist may perform. And these 3 states have extensive lists compared to just adding these 2 tests to a list that's currently 4 in California. California used to lead the nation in progressive pharmacy reform, and in this one, you are severely behind the curve, and I think this would be your opportunity to open this up to every CLIA waive test, like 46 other states have done. Also, technicians are only restricted from performing CLIA waive tasks in 3 states, and there is a 4th state if it involves blood, like a finger prick. So the overwhelming majority of the other states allow technicians to perform CLIA waive tests under the supervision of the laboratory director, which would presumably be the PIC. Again, kind of behind the curve, if you will. I also would be remiss if I didn't thank the board's legal counsel yesterday for clarifying that the term perform any aspect includes the act of ordering. And I would greatly appreciate it if the minutes would show that. Thank you very much, board. I appreciate the effort.
Thanks, Mark. Just board members, just to clarify his 2 statements about tech and CLIA waive, expanding to all CLIA waive tests. That was in regards to my opening comments in this section that is going to be a future agenda item. Our council, because we did not notice that we could possibly be talking about a test other than these 2, nor did we notice that we'd be talking about technicians. We do not have the ability to do that during our license committee meeting yesterday, but once again, it will be on a future agenda. Thank you, Mark.
Our next comment comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Yes, good morning. Thank you. And good morning, President Lippy and board members. I'm Paige Talley with the California Council for the Advancement of Pharmacy, and I just want to express my support for this motion and the changes. Thank you.
Thanks, Paige.
And our next comment comes from Daniel Martinez. Daniel, your line is open and you will have 2 minutes.
Thank you, Mr. President, members of the board. Danny Martinez with the California Pharmacists Association. Also want to express our support for the amended legislative proposal. We look forward to advocating for its passage in the legislature. Thank you.
And that concludes our request for public comment at this time. Would you like me to close the panel?
Thank you, Danny, for your comments. And yes, moderator, please close the panel.
It is closed.
Thank you.
Debbie,
Okay.
for the record, I just wanted to note that I'm here. This is Shirley.
Thanks, Shirley. Great to have you. Okay, so the next item, the next part of agenda item B was to look at the addition of adding an addition BPC section 4119.10. So we're adding this whole section. I'm not going to read it, but because it is in your materials. It does address everything that we have discussed in the past couple meetings that need to be part of this process and the expectations of what should be in the policy and procedure manual, and what each pharmacy would need to do in order to implement the testing for the addition of the testing for the for the COVID and influenza. In addition, I just want to note that in number 3, and actually there might be another spot, that it mentions pharmacists in charge, and there was comment from the stakeholders that we should remove references to pharmacists in charge in this section in 4119.10, because we did hear that some of the schools of pharmacy, do testing, and they do not have a pharmacy. However, our legal counsel clarified, and maybe it was executive officer, clarified for us that this section that we're talking about is if a pharmacy actually provides the testing. If a college of pharmacy is providing the testing and they do not have a pharmacy, then they're actually doing it as the director of lab and under section 1265. So in that case, you don't have to have, so that case, a regular pharmacist could, could manage the clinic. I'm hoping I'm making myself clear. If not, please ask questions. So with that said, the motion that was passed by the committee was to accept the addition of BPC section 4119.10 as presented. So the motion to the board is for the board. Oh, Greg, we didn't vote on that last one. Greg, we need to vote on the last motion.
Yes, thank you.
So let me just stop for a minute and then I'll make our next motion.
Okay, repeat the motion so everybody knows what they're voting on.
Okay, so the motion from the committee that actually passed unanimously was to accept the addition to 4052.4, adding section B1 and removing in pharmacy, which is present in the materials, and give our executive officer the authority to make non-substantive changes. Thank you. Okay, I'll call roll. Ryan Brooks?
Yes.
Thank you. Cheryl Butler?
Yes.
Thank you. Sung Oh?
Yes.
Sung, are you muted?
Yes.
Thank you. Jig Patel?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Maria Serpa?
Yeah.
Thank you. Debbie Veal?
Yes.
Thank you. Jason Weiss.
Abstain. And just for a point of clarification, I also had to abstain in committee. Thank you.
Okay, thank you, Jason. Albert Wong.
Yes.
Thank you. I vote yes. Motion passes.
Greg,
Go ahead, Debbie.
Shirley Kim is also here, and I vote yes.
Yes, Shirley, you're back. Thank you.
Okay, so now on to our next motion. And I'll say the motion again. So the motion was to accept the addition of BPC section 4119.10 as presented in the materials, the board materials. That was also unanimous with Jason abstaining. Since it is a motion from the committee to the board to accept this, I do not need a second.
Correct.
Committee members, is there anything else that you want to add to the comments I made about 4119.10? Okay, hearing none. Board members, were there any questions about 4119.10, what we're adding or any of the provisions? Okay, hearing none.
Go ahead, Deb.
Moderator, can you please open up the Q&A panel for questions from the public?
Listen, moderator, we have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. Our first comment comes from Daniel Martinez. Danny, your line is open. You will have 2 minutes.
Thank you. Actually, I wanted to ask a clarification question. So yesterday, when Ms. Veal was talking about that the stakeholders had issues with the pharmacist in charge term, I don't believe it was for this particular section. I believe it was for the ensuing section of BPC 1209. And if Dr. Gray is on the line and he comments, I believe that's where he and I both made comments that there was an issue. We can talk about that in the next section, but I want to clarify that I don't believe it was for this section that we had an issue with that.
Okay, thanks. It was actually brought up twice. It was actually brought up both in this discussion, and maybe he was referring to the next section, but it was brought up both times.
Seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Okay.
Okay.
President, can we call for the vote?
Yep. Okay. Brian Brooks.
Yes.
Thank you. Carol Butler.
Yes.
Thank you. Shirley Kim.
Yes.
Thank you. Sung Oh.
Yes.
Thank you. Jig Patel.
Yes.
Thank you. Maria Serpa.
Yes.
Thank you. Ricardo Sanchez. Ricardo, are you unmuted? Okay, I'll go on to Debbie Veal.
Yes.
Thank you. Jason Weiss?
Abstain.
Yes. Okay. And Albert Wong?
Yes.
Okay, I'll come back. Let's see. Oh, that's okay. We have a quorum. I vote.
Ricardo was yes.
Okay, thank you. Okay, it passes. Go ahead, Debbie.
Okay, next we looked at the final 2 sections together, which was to amend BPC section 1206.5 as well as 1209. Scrolling. 1209, as noticed in your materials, and there was once again there was a comment about the pharmacist in charge that needed to be removed, and we once again kind of talked about it wasn't necessary because of we're talking about testing being administered by a pharmacy, which has a pharmacist in charge. If testing was being done outside of a pharmacy, such as in the case of the college, then it would fall under the director of laboratory, and that is allowed through 1265. So there was a motion that passed unanimously with Jason abstaining to accept the changes in 1206.5 and 1209 and allow the EO to make any non-substantive changes if necessary. Committee members, were there any other comments or clarification that you'd like to add? Board members, do you have any questions? Okay, moderator, can you please open up the Q&A panel?
This is the moderator. We have opened the Q&A panel for public comment. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first comment comes from Daniel Martinez. Danny, your line is open and you will have 2 minutes.
Thank you. So yes, this is the section where I made comments yesterday of perhaps removing the term pharmacist in charge and instead replacing it with pharmacist. And the reason for this, and this may be a point of disagreement here that we may have, is that section 1209 refers to the director of a laboratory, which is independent of a pharmacy. They're two separate settings. If the way the language is written right now in subsection A2E, only a pharmacist in charge would be able to serve as a laboratory director, which means that no other pharmacist in the pharmacy could serve in that role. And for what we're saying is that if you were to take it to a school or place of business or some other area where you're doing a mass testing facility, the only person that could be labeled as laboratory director under the current language is the pharmacist in charge. If there was another pharmacy, or rather another pharmacist who worked for that pharmacist in charge, or in the cases previously mentioned, somebody who is a pharmacist, but they don't have a pharmacist in charge in their regular course of business, they would not be able to serve as a laboratory director, which means that they may not only have the ability to run the clinic, they would have to find either a licensed physician, laboratory scientist, naturopathic doctor, or optometrist to serve as a laboratory director. So, and just to try and keep in with the rest of the folks that are listed here under A2, duly licensed, we would ask that you replace pharmacist in charge with duly licensed pharmacist, so that there would be no confusion on this. Thank you.
Anne or Eileen, do you want to comment on his, or make a response to his comment, just to kind of clarify for the other board members who were not part of the call yesterday?
Yeah, so this is Anne. So I think what I want to clarify is that this is speaking to who would be the laboratory director. There is, as far as I am aware, no requirement for the laboratory director to be on site at a temporary testing location, mobile testing location, or even on site at the time that testing is occurring, even within a pharmacy. So in the same fashion that a pharmacy has a pharmacist in charge, the pharmacy can operate without the pharmacist in charge present, but the pharmacist in charge is responsible for the operations of the pharmacy. So the language and the proposal, I believe, mirrors the same concept in that the pharmacist, we are stating that the appropriate person to serve as the laboratory director is the pharmacist in charge. And like I said, I am not aware of any requirement for the laboratory director to be on site when testing is occurring.
Thank you, Anne. And Danny, thank you for your comments.
Our next comment comes from Stephen Gray. Steve, your line is open and you will have 2 minutes.
Yes, thank you very much, and thank you for the opportunity to clarify. I do agree with Danny Martinez, and I think it's as much a legal issue and a practical issue. We have a situation here where you're going to have two sections of the Business and Professions Code that seem to be in conflict with each other. So you've clarified up in 405 2.4 that it doesn't have to be in a pharmacy, and you've explained that that would cover the situation, for an example, like at Toro, where they don't have a pharmacy and they're doing the acts that it allows them to do. But down here in 1209, you've listed everybody, physician, everybody else, naturopathic doctor, etc. And then the people over who in CDPH who are interpreting the law, they're going to look at Section E the way it is drafted now, and they say, oh, this only applies to a pharmacist in charge. I think that I think that Anne is also correct in that the pharmacist in charge wouldn't necessarily have to be present, just like they don't have to be always present inside a pharmacy. So perhaps the corrective way is to do what Danny said, is to list Section E as a duly licensed pharmacist, etc., and then have Section F explain that if the is done under the auspices of a pharmacy, it is the pharmacist in charge that is the director. I think that would save a lot of controversy and some very, having to go back and clarify this again if you would make it clear in this section, which is looked at by the CDPH people, and probably never go back and look at 405 2.4 because that's just not what they do. And prevent this in the future. So I would support a duly licensed pharmacist in E, and then a clarification that if it's done in a pharmacy, it's the pharmacist in charge, which is what the committee is putting forward.
So, Steve, just to clarify, ICE, you're saying that F would be an addition?
Well, in terms of numbering, I would say change E because that fits the stream, and then take what you have said and say if a pharmacy is doing it under its auspice, it's the pharmacist in charge. Words to that effect.
And once again, do you want to comment or Eileen?
So I believe that we're talking about expanding the authority for pharmacists, and we're speaking also about pharmacy specific. And so the intent of the language here is to clarify that where a pharmacy is seeking licensure or registration as a laboratory, that a PIC is authorized to serve as the laboratory director. And I do believe that there's other provisions in the law under the LFS code. I apologize, I don't have the language right in front of me, where there is similar provision and construct that specifies that the PIC may serve as the laboratory director for pharmacies seeking registration or recognition as a laboratory.
Anne, thank you for your comments, and Steve as well.
Our next comment comes from Robert Stein. Robert, your line is open and you will have 2 minutes.
Thank you. Good morning. I just want to, I'm speaking as an individual in this case. I do teach pharmacy law and ethics at KGI School of Pharmacy. It seems to me that we're kind of nibbling around the edges of a core issue here. If you look at Business and Professions Code 1206.5 A11, it refers specifically to ordering drug therapy related laboratory tests. Why do we have a limitation here and we're talking about expanding in other areas rather than basically dealing with the places that talk about drug therapy specific, because COVID testing and influenza testing aren't arguably drug therapy related? Why not just open it up to all laboratory tests as part of the scope of practice of that pharmacist? Thanks.
Thanks, Robert. And please come to our next committee meetings. That is actually what we're going to be talking about.
And that concludes the request for comments for this round. Would you like me to close the panel?
Yes, please.
It is closed.
Okay, Mr. President, the motion that has been made by the committee for the board is that we recommend acceptance of the changes to 1206.5 and 1209 as outlaid in our material, and if needed, allowing the EO to make non-substantive changes if necessary.
Thank you, Debbie. Okay, I'll take the roll call. Ryan Brooks?
Yes.
Thank you. Carol Butler?
Yes.
Thank you. Shirley Kim?
Yes.
Thank you. Sung Ho?
Yes.
Thank you. Jig Patel?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Debbie Veal?
Yes.
Thank you. Jason Weiss?
Abstain.
I'm sorry, I didn't hear that. What'd you say?
Abstain.
Abstain. Okay. And Albert Wong?
Yes.
Thank you. And I vote yes. Motion passes. Go ahead, Debbie.
One thing I do want to mention is with the section we just talked about, as well as the next section we're going to be talking about, we are now basically by making these statutory proposals, we're going to be, asking the staff to find authors for these items that have passed, and we need to acknowledge that the language we're presenting is basically, this is what we suggest, and we know that once it gets in the legislative process that things could change. Specifically on this section we just finished, one of the comments that was made during our meeting was that perhaps during the legislative process and reviewing the bill, and depending on who carries this bill, at that time they could add in the CLIA additional, all CLIA waive tests as well as technicians. So that could happen but also we are planning to bring it back to the full board. So the next section, item C, is discussion and consideration of the statutory proposal to expand authority for pharmacy technicians to administer COVID-19 and influenza vaccines. So once again, very similar to what we just described. There's relevant law that is, in your material. I'm not going to go over that. There was also a policy agreed to by the board in October that said that, during this COVID time period that we are in support of allowing pharmacy technicians to administer COVID-19 and influenza vaccines. And in addition, our intent is to move forward with a permanent solution through statutory or regulatory change. So that is the purpose of the agenda item for the committee yesterday and for discussion today is moving towards a permanent solution through statutory change. So we talked a little bit about what that meant. That we wanted to potentially pull forward as we created the statutory proposed document. We end up with two motions. The first motion was to move forward. We found there's very definitely two trains of thought. One train of thought a permanent solution at this point in time, but should wait for a workforce survey or some additional. Should just kind of put this on hold for now, see what happens with the COVID and influenza vaccines that are being. a statutory change, with the understanding that that would probably mean it's not going to be in a future legislative year. So it would, there would be some time period. And a number of months now why this will be in process, so that we'll be able to kind of see what happens, and that there is no, and we can, at that point in time, see how it worked out. The other camp was and that they thought that it absolutely was time to look at we were supportive of moving forward and embracing a statutory change. So what we found ourselves, and we had in both camps, I think we had individuals who had, well, for sure in the camp that they wanted to move forward, we had at least one pharmacist who said, I've actually been working in this environment and I support it. I think the other group might have had someone that felt like they were things were being pressured. So with that comment that we got from the stakeholders, the decision was made that we need to first decide if the committee wants to move forward with the statutory proposal before we start, tearing apart the statutory proposal. So there was a motion to move forward with the statutory proposal, which was voted down. 3 voted against, and 2 of the committee members voted for, with 1 person abstaining. So then we had a second motion come up, and that motion was to table this issue for the time being until the workforce survey was complete. And that passed. 3 board members voted for it and 2 voted against it. So at this point, the recommendation to the full board coming from the committee is to table the moving for a statutory change, allowing technicians to administer COVID and influenza at this point in time until we have the workforce survey, which we're going to be talking about in a future agenda item, until we have that completed and that information. So that's the recommendation. That's the motion that's coming from the committee to the board. Committee members, I know there was a lot of discussion on this, and so I don't know if anybody wants to, talk to this motion and has any further comments than what I've outlaid. So committee members, can I start with you first?
Hi, Debbie. This is Jake Patel. I do agree with one fact that putting this away for future is not a good idea. And as a board, we need to decide and to enable our licensees to administer every single vaccination that's out there and would come out there. So we are better prepared for any pandemic that comes our way. God forbid there is another pandemic. Are we going to be ready? We just passed the point of care testing. We are considering all of our pharmacies to be able to do that, all of our licensees to participate. Testing and vaccinations puts end to pandemics quickly. And I think that for the board to stay relevant, we need to take care of this as soon as possible and not put it away.
Hello, Debbie.
Yes.
I think the board is relevant, and I support what the committee supported, which is saying that this is premature statutory proposal. The DCA has issued an unchallenged waiver to allow this to happen right now. And, you know, we are extending waivers all the time. We can, right now with the rollout, we're having pharmacists having to give the vaccine within 10 minutes, not able to do the other work while other patients are waiting. Every day I'm having to look at how many stores, since Christmas, at least 100 stores a day are having someone diagnosed with the virus. My drugstores, even CVS, 30 yesterday, 15 in the pharmacy. I think we have right now the ability to do that, and we need to see how that's going to roll out. The pharmacists right now are completely stressed out, and the techs without extra help. And again, we have a waiver in place that can take care of this right now. So we are taking care of our patients. And the main thing is, I keep hearing this referral about many states and what many states are doing. There are many states, I mean, in this pandemic, I've seen there's many states that's been about the money and not about the people. And I think we have, at this particular time, I suggest that we stick with what the committee recommendation is.
I have a further comment to make about, we are in a state where OSHA and we operate under some of the stringent labor laws in the country or even in the world. And working conditions and all of that is not something that is primary compared to where we are trying to fight these pandemics and be ready for anything that comes our way. In 30 days from now or 60 days from now, let's say if we have an Ebola outbreak, we got to have all hands on deck ready. And this board approves and empowers every single licensee to participate best to
we are participating. That's why we have a waiver.
I have something to say about this. I do really think that this discussion is very sensitive, obviously, but I think we all need to understand what is actually going on out there. As I said, and we heard comments like, oh no, pharmacists are struggling, so just throw in pharmacy technicians. It's going to automatically resolve all the issues. That is absolutely not the case. We are going to have pharmacists who are already spread thin to actually supervise technicians to do this when they already have duties that they are responsible for in pharmacies, which they are not able to perform. I have tens and hundreds of colleagues who are immensely under pressure because they cannot do their job. So if we say that California has very high standards for labor laws, well, it's not good enough then, because clearly we have pharmacists who are making medication errors after medication errors. I know so many cases of incidences of what should not have happened because our corporate partners are not providing adequate support, unfortunately, for our pharmacist colleagues who are out there working in this field. So just throwing pharmacy technicians to administer this vaccination is not going to solve. If anything, we need to add more pharmacists to the workforce, which that should be the primary focus of alleviating our problems. So I'm hoping that we can all come to agreement on what's actually going on out there. That's why we need to also have a clearer understanding of how our licensees feel of what's happening and to what our committee supported, which is to look at what the workforce survey states. So I really think we need to look at this with a full, clear understanding of what's going on. And yes, Jake, if Ebola were to happen, unfortunately, it's not going to be allowed because this is only for COVID and influenza vaccines.
Hey, good,
Okay, any other comments or questions from the board members?
Hey, good morning, it's Ryan Brooks. And so I'm not quite sure I'm following the logic behind this. And so a farm technician is supervised by the PIC. If the PIC feels that the environment is unsafe for the customer, the PIC should be in charge of managing those issues. Right? One, number two, I don't. Pharmacies are going to also go to an appointment scenario where, hey, if we know we're going to be too busy, you can make an appointment. And so there's multiple ways of making sure the workflow is smooth. Making a blanket statement that they just can't handle this and this goes across all pharmacies, I don't think that's correct.
I'd like to make the comment that, first of all, in these stores, they are making appointments. The appointments are every 10 minutes, and the workload is just that pharmacist and a tech. And unfortunately, everything else that pharmacist has to do is still there. And in these chains, they do not have the ability to make the decision that we need more help and get that help. So the PIC is there, but the PIC is there by themselves.
But is that a management issue versus a health issue? If the appointments are 20 minutes apart, 30 minutes apart, or first come, first serve, I mean, there's ways of managing the workflow.
Well, the problem is that the workflow is not being managed, and we are in a pandemic, and that we don't need to prematurely make this the rule when we don't even see that it is working.
This is Maria. I'd like to chime in and expand upon Mr. Brooks' comments. I think this is a little frustrating for me because of the discussion about business operations and workflow and workload, which are really close to all of our hearts. We all work in different environments and constantly are bombarded with what's required, what's optional, and our employee-employer relationships. But those are not typically under board's purview. Our purview is to provide for processes that are safe and for patient care. We're not requiring anything. We're just making this an optional process for pharmacies and PICs to be able to provide for public safety and public health. And it's not a requirement. I hear the message and I don't know where to take the information on if employers are making this a requirement. That's an employee-employer labor board kind of issue, which is important and should be vocalized here also. But that's not typically what the board provides input or comment on. We don't have any maximum prescriptions per pharmacist, for example. There's no law that says pharmacists should only fill 100 prescriptions per day or per how many per hour. There's no law that says that. It's between the pharmacist owners and PICs to determine their staffing needs. So if your pharmacist owner comes to you and says you will fill 1,000 prescriptions a day, that's not someplace for the board to get involved with. We don't have any laws that says what the maximum should be. We just want to make sure that the required steps for every prescription are done. And if that takes longer, that you're unable to do the request of your employer, then that is something that the pharmacist needs to take into account, because legally they need to put the patient first and have those discussions with their employer. I'm not sure if I stated my opinion clearly, but I'm kind of frustrated in what is the scope and role of this board versus the true problems that are out there in the work environment.
Excuse me.
Maria, if I may say to
respect-
that, I think so it is, you are absolutely correct, and I totally hear your frustration. Yes, it is hard for, us to really figure out what our role is in these circumstances. But the reason why I strongly feel that it is really relevant for us is that because of what's going on out there, there are increased medication errors. There are increased giving wrong vaccination to wrong people. So at one point, when are we going to say that is just between employer and employee? That, at one point it comes to us and we have to try to do something to protect the public when a pharmacist is constantly making mistakes because they're under such pressures. So that's just a bigger discussion we need to have. And I understand, but I just want you to understand the reason why I feel strongly about what our role and how we need to be involved is because this is directly related to medication errors. This is directly related to pharmacists making, unfortunately, wrong decisions, and they're not able to perform their duties. So that's why I just think that this is important for us to have a discussion.
So just to follow up on that, do you have any data, or has the staff been asked to pull data on reported errors? Either have they been increasing, or have they been increasing that's related to increasing functions? Because I think we all hear anecdotal stories, but it's really hard to get an impression of what's the story out there for the entire state.
Right, exactly. That's why that's why I said that we need to get the workforce studies result back, and so that we can actually be very clear on where we stand objectively. Because I also know a lot of pharmacists are afraid to report medication errors, and that because of the consequences, and that they would be the blame for anything that went wrong, even though the conditions they work in makes it impossible for them to do their jobs.
And I just like to comment also that our mandate is public protection. It's just right now I see in the stores I've talked to many pharmacists, and they are so completely stressed out right now, and this is just now rolling out. And again, our mandate is public protection, and that is supposed to be paramount.
Excuse me.
Okay.
Can I say something?
Yeah.
I'm having a little problem figuring out what additional workload is added to the pharmacist by this, because our definition of direct supervision does not require a pharmacist to watch the person giving the injection. It only requires the pharmacist to be at the premise and to know what the person is doing. So is the problem that by passing something like this, it would increase the flow of or the volume of vaccinations, and therefore, because it would increase the volume, it would keep the tech away from doing something that the tech needs to do to alleviate the pharmacist? Or what is the additional workflow on the pharmacist? That's what I'm trying to find out.
Well, first of all, the pharmacist is responsible for whatever happens in the pharmacy. They're still responsible for whatever the tech does. So that's additional. That in itself is additional work. And we're not asking that this not be looked at. We're just saying here that we'd like to see this roll out, just like you do the waivers and you extend the waivers. And this is something that we can look at a later date. That's all that we're asking for right here.
Understood.
Good
Thank you,
question,
Cheryl.
Greg. Also,
Yeah.
to your question, Greg, and to
Yes.
add it, the challenge is also, a pharmacy has a staff. The problem is the pharmacists are not given any adequate additional staff if the technicians are performing this. So someone is filling in the hole there that is not able to be done by a pharmacy technician. So if the additional technicians are provided, that's great. But the problem is that they're being told to do this with the current level of staffing, and it's not really helping anything because now pharmacy technicians who would be better served of doing something else are now being pulled to giving immunizations, and pharmacists are now having to deal with what the technicians' duties are, and they are not able to balance their duties. And so that's another reason for challenges of why we feel this is a little premature.
And that was
Greg,
my
Greg, let me
question.
just, the other thing that I think is not being shared here is it's making it sound like either the technician are doing it or the pharmacist is doing it. And the way I look at this waiver and this opportunity that I think we actually have here for California, like Maria said, we're not mandating it. We're just trying to make it an opportunity. It actually adds flexibility to the pharmacy. So the pharmacist who's on duty can make a decision, is it best for me right now because I need the technicians to be filling prescriptions, so maybe I go do the vaccines, or wait a minute, I need to get caught up with counseling and prescriptions are filled, so I'm going to have the technician go administer the vaccine. I actually think that we do need to move forward with this into a statutory process, and I do think that we have enough information. Administering vaccines is not a mystery. There's lots of studies out there about how effective it can be, and the technician just adds flexibility to the flow. It does, it's not that it has to be them, it has to be the pharmacist. It just adds flexibility so you can work around busy times. I also hear that what Song and Cheryl are saying is maybe the employers aren't adding enough help in. You have all these people coming in for the COVID vaccine, but I think, as Maria said, I don't think that's ours to fix, and I don't think by not allowing technicians to move, by not moving this to the statutory situation, that doesn't fix that, and so then you just leave all this stress with the pharmacist as opposed to giving them flexibility. Anyway, that's my 2 cents.
I wish it is the flexibility is there, Debbie. I absolutely wish that it is true, but the truth of the matter is a lot of technicians are being pressured, undue pressures to do this, or that they're being threatened to be transferred to other stores. So I just don't know if that's as
so
true
that
as
might
it
be
is.
your experience, Song, but that's not what I'm hearing.
That's not my
What I'm
experience
hearing is that that technicians, I'm sure, just like when we gave this, vaccines to immunization to pharmacists, I'm positive you're right that there's technicians out there who don't want to do it. But I also know that there's a lot of technicians out there that want to do it and like the additional challenge. They think it makes their job more diverse and fun. I don't know if fun's the right word, but it's probably not. But they like the challenge, and they think that this is something that makes them feel a stronger part of the team. So I understand what you're saying, but
yeah.
I don't think it's I don't think we can say that.
You're right.
none of
You're right, Debbie. And
Great.
that's
This is
why I
Albert.
think we need to do the survey.
Great. This is Albert.
I don't understand.
The survey's not going to answer that question.
We're not trying to not have, I mean, obviously we have a waiver on file, and all we're asking is just let this roll out. They're doing it. We're doing it. We're just asking to hold off and wait and see how it goes.
Great.
Well, I think
This
we
is
already know
Albert.
how it goes.
This is
Can
No, you don't know how it
Hold
goes.
on.
It just
Wait a
rolled
minute.
out.
Wait a minute. Let's let one person speak at a time. Albert has requested to speak. Everybody else has already spoken.
Right.
Albert, go ahead.
I agree with what Son and Cheryl comment. A lot of time the board members not in the real world, so they don't know what the real situation. So I agree with them. The waiver is there. They're doing what they're doing now. So what's the hurry? All we're saying is wait until the survey, get some feedback, and see how things go. Then we make a decision. So I mean, they could do whatever they want to do right now. So that's there's no hurry for that. That's what I want to say.
Thank you, Albert.
This is Ricardo. I'd like to say something too.
Yes, Ricardo, please go ahead.
Yeah, I'm trying to listening to both sides there, but the waivers are working right now. Things are going forward, and we could always revert back to making it permanent if we have to. If it's not broken, why fix it right now? Is basically what I'm thinking.
Thank you, Ricardo.
And this is Ryan. I don't think we should have to burden each individual pharmacy to have a waiver to do this. One. Two, our job also is to focus on access to the community. So by not having this available, limits, especially in communities of color, for people to get other vaccinations. And three, Maria Sherpa is 100% correct. If there is a labor issue, that should be done with the labor board. This is not our jurisdiction. And last, number four, this is not a mandate. This is an opportunity for those pharmacies, those responsible pharmacies, to create a program and to administer these vaccinations safely. And I do believe that, the pharmacists in charge, the responsible, overwhelming majority of pharmacists across, California, they do a fantastic job. Of course, there'll be anomalies out there, but we should not base this on those anomalies. We should base it on the greater good for the public that's out there.
Thank you, Ryan.
And
Is there anybody that has not spoken that would like to speak?
Greg, one more comment. I think the comments is not the board's responsibility, but I think it is because consumer protection and safety is the board's responsibility. So when the condition out there is not right, then we have to get involved.
Thank you. Okay, we're going to get to the point where, we're just rehashing everything. So if anybody has anything new to say, please do it. Otherwise, I think we should open it up to the public.
I'd like to make one comment that Cal OSHA is severely understaffed and under-resourced to investigate workplace issues. And we need good working conditions. Unsafe to add because carpet companies will require and do not give pharmacists the choice. And so I do feel that this is something, again, that we just want to get some weight and get some feedback. And for as underserved communities, this is all we're asking is just to see how it works. That's what we're asking.
Thank you, Cheryl. Okay, I think it's time to open up to the public. Debbie, would you agree?
I would agree. Moderator, would you please open up the Q&A panel so we can hear from the stakeholders? And I think, Greg, as you said in the beginning, we want to keep comments to 2 minutes, correct?
Correct.
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. At this time, our first request comes from Jazzy Graywall. And Jazzy, your line is open and you will have 2 minutes.
Can you all hear me?
Yes.
Great, thank you. Good morning, Chair and board members. My name is Jazzy Graywall with UFCW Western States Council, speaking on behalf of our pharmacists and pharmacy technicians in the drug retail setting who are unable to be here today due to the overwhelming amount of work that pandemic and recent COVID-19 vaccinations have caused. For 2 reasons, we strongly oppose this premature statutory proposal. First, DCA just recently issued a waiver to allow pharmacy technicians to administer vaccines. Therefore, a bill is not needed to address the pandemic. Second, the recent waivers and changes issued by this board and DCA, according to numerous calls from frightened and angry pharmacists inundating our leaders in LA County, this is not an anomaly in LA County, has caused dangerously chaotic situations in community pharmacies administering COVID-19 vaccines. Notwithstanding the staffing orders permitting greater ratios, we have not seen pharmacy technician staffing increases to handle the distribution of the COVID-19 vaccine and testing. There is a chronic understaffing problem at low volume community pharmacies that will not be addressed by simply changing the ratios. At one large grocery chain, it has been reported that pharmacists who continue to work 12-hour shifts alone are responsible for administering COVID-19 vaccines every 15 minutes throughout the whole day, leaving no time in between appointments for breaks, to monitor allergic reactions, or to complete other tasks like filling prescriptions. The recent addition of 65 and older adults for vaccine priority has overwhelmed and backlogged pharmacy phone lines and in-person lines with individuals trying to reserve a vaccine appointment, making it difficult for doctors and prescribers to reach the pharmacist to order prescriptions and refills for sick patients, ultimately compromising patient safety. Store managers have instructed pharmacy staff to not cancel vaccine appointments, leaving the lone pharmacist and or technician to have to choose between vaccinating patients or filling prescriptions. Some pharmacists have deemed the conditions in the pharmacy so unsafe, they defied the demands of their store manager, who threatened them with being fired and canceled vaccine appointments to attend to the dire backlog of prescription refills,
10 seconds.
often not being able to meet the arbitrary quotas instituted by these chain pharmacies. Therefore, for all these reasons, we strongly oppose any statutory change at this time. Just thank you so much for allowing us to make comments today. It's very dire as the rollout is happening.
Thank you, Jesse, for your comments.
Our next comment comes from Lindsay Golohorn.
Thank you. This is Lindsay Golohorn again with CRA and NACDS. And first, want to thank Chairwoman Veal, the licensing committee members, and board staff for the robust discussion yesterday regarding this proposal, and for the and to the board members for the discussion today. We absolutely respect the concerns of some of the committee members, but we would still urge the board to move forward today with pursuing statutory authority for technicians to administer the flu and COVID-19 vaccines. It is true that a waiver is currently in place to allow this, but that waiver is temporary. Concerns have been voiced about the need to see how the waiver is working before pursuing permanent authorization, but it's important to point out the fact that approving this proposal today does not make it law immediately. It would still have to go through a lengthy legislative process where it would be subject to negotiation and amendments. Also, the primary concern right now is and should be patient safety. Allowing technicians to administer the vaccine is consistent with the board's mission to protect patients because it accelerates administration of the vaccine. According to a recent California Healthcare Foundation survey, 71% of Californians plan to receive the COVID-19 vaccine, and 86% believe it is important for policymakers to make sure there are enough healthcare providers to control the spread of the virus. It will take the rest of 2021 to vaccinate just half of California's population at the current rate, and until next May for 70% of the population to be vaccinated. Even after the current public health emergency, COVID-19 will remain with us, and we will need all of the available qualified healthcare resources in California to administer vaccines and prevent another crisis. So for these reasons, we hope we can continue to work with the board on this, and thank you and thank the board staff for their work on this issue.
Thank you, Lindsay.
Our next comment comes from Paige Talley. Paige, your line is open and you will have 2 minutes.
Okay, thank you. And thank you, Chairman Veal, and committee members and board members. I think everyone knows that, I'm sorry, I'm Paige Talley with the California Council for the Advancement of Pharmacy, and CCAP for short. And CCAP does oppose the motion, but I'm not going to belabor that. However, I want to make this one comment, that I have heard members talking about that you do not represent labor and you don't get involved in that. And I understand that. But by law, you are supposed to have a union person represented on your board. And actually you do. And I think that perhaps you need to pay attention to what she's saying, because she probably knows what's happening. And with that, I'll close just saying I think this should be tabled for a while. Thank you.
Thanks, Paige.
Our next comment comes from Keith Yoshizuka. Keith, your line is open. You will have 2 minutes.
Thank you very much. Keith Yoshizuka, president of CSHP, speaking on behalf of CSHP. We would encourage the board to move forward with the statutory proposal. I've heard a lot of questions saying, why is there, what is the hurry? The hurry is that there is a legislative deadline. All bills must be introduced by February 19th. Otherwise, you have to wait another year. As it was pointed out earlier, just because we introduce the legislation does not mean it passes. There is time for the modification, it's time for reconsideration, and if ultimately the board decides after it reviews the report that it no longer wants to pursue the passage of this, you can ask the author to withdraw it. It buys you some time. And if we miss this opportunity, then we have to wait another year before legislation could be introduced. In addition, I wanted to say that CSHP has just got done completing its first beta test of the technician training to give the immunizations, and it was a tremendous success. All participants felt that it was worthwhile, and they are looking forward to administering the COVID vaccines to help the effort for public safety. Thank you.
Thank you, Keith.
Our next comment comes from Rob Geddes. Rob, your line is open and you will have 2 minutes.
Hi, thank you very much, Board President, and appreciate the opportunity to speak. I'm Rob Geddes, and I represent Stapleton Albertsons pharmacies in the state. A couple of comments. I do want to enforce the comments that Member Veal did make in regards to allowing flexibility. In my last role as a pharmacy manager in the state of Idaho, prior to moving to a different role with the company, had supervised for over 2 years technicians who administered vaccines. And I can tell you from firsthand experience that that flexibility is in fact true. Allowed me to make decisions as a pharmacy manager and as just a pharmacist between reviewing an antibiotic for a child that was waiting and a parent that needed to get that child home versus going out and giving the vaccine. And I can say that in those situations, I made the assessment of which patient needed my time and my attention, and the technician was directed to take care of the other instance. And about half the time I would administer the vaccine versus my technicians taking care of the vaccine when I had other pressing matters in the pharmacy to take care of. It's not an increased burden of labor. In fact, it's a reallocation of the focus of the pharmacist. Just because technicians would not be eligible to give vaccines as a permanent basis does not mean that those individuals who need the vaccine are going to choose to go elsewhere for the vaccine. So either the pharmacist does 100% of the work for every vaccine, or if they have assistance from a technician who can legitimately and expertly take care of the steps that they've been trained to do. Lastly, I do want to make sure that I'd be remiss if I didn't mention that at our company, I want to make it clear that we have not mandated any pharmacy technicians or pharmacists to participate, nor have we made any threats to transfer or terminate employment for individuals who choose not to. We made a collective decision that this
10 seconds
for pharmacists to participate, and it should be at the discretion of the pharmacist as they go. Thank you very much, and we do support this moving forward as a statutory proposal.
Thank you, Rob.
Our next comment comes from Mark Johnston. Mark, your line is open. You will have 2 minutes.
Thank you, Mark Johnston, CBS Health. While the California board runs maybe the best WebEx board meetings, it is unfortunate that we can't meet in person. So I wanted to, remind some of the newer board members of my past. I was the executive director of the Idaho Board of Pharmacy for nearly 8 years. Idaho was the very first state to allow tech immunization. So there is a wealth of information out there outside of California on tech immunizations. I've heard some board members talk about some really scary errors that are happening in California. I can say, sitting in the executive director's chair, that with no ratio, tax being able to administer, we don't even have PICs in Idaho. myself and my successors have never received a complaint concerning a tech immunization. Zero. And we've got to be in the hundreds of thousands, if not more, immunizations that techs have given in Idaho now. I do not see a correlation between tech immunization and increased errors. If anything, I see a decreased correlation. We receive very few errors at the Board of Pharmacy level with our model of no ratio, no PIC, techs being able to do expanded duties. So I agree you have something serious to look at in California, but tech immunization is there to help. It provides flexibility. If certain people can't manage additional techs, that's fine. You don't have to use the additional techs, but don't penalize the people who can and are able to better patient safety by using tech administration. Survey data is the lowest level of confidence out of all of the published papers. There's plenty of published papers on this out there on tech satisfaction,
10 seconds.
tech error rate, all sorts of great scientific literature that I would encourage you to look at and move this forward before the February bill deadline. Thank you very much.
Thank you, Mark.
Our next comment comes from Daniel Martinez. Danny, your line is open. You will have 2 minutes.
Can you hear me?
Yes, we can.
Yes.
Okay. Thanks. Danny Martinez with CPHA. As I mentioned yesterday, per our policy, our recently passed policy at our last House of Delegates meeting, we are in support of this proposal to allow pharmacy technicians to perform the technical task of administering the COVID and flu vaccines. I do want to touch on some comments that have been made. Yes, this does increase the workload of the pharmacist, of the supervising pharmacist. Given the nature of the board and its enforcement-driven agenda of getting at every little thing that a pharmacist does, there is concern from pharmacists to essentially allow their technicians to do this, which is one of the reasons why we've been advocating transferring some of the responsibility to the actual technician. And so I do want to make that point. The other point I want to make is that we are in a situation where there is an immediate healthcare need. COVID's not going away anytime soon. The vaccinations right now are slowly rolling. Hopefully it'll get better, but we don't know if it'll get better. And we do need all hands on deck. But I do want to stress that both can be true, that yes, we do need techs out there, and yes, this does increase the workload of the supervising pharmacist. And if that may at times present situations where pharmacists will be overburdened. And this is maybe a point at where the board can revisit some of its policies on the pharmacists, if they're going to be allowing techs to do this, to perhaps revisit whether or not techs need more scrutiny on their license. So I just want to make those comments and look forward to the action today. Thank you.
Thanks, Danny.
Our next comment comes from Lori Walmsley. Lori, your line is open. You will have 2 minutes.
Hi, board members. Lori Walmsley on behalf of Walgreens. Thank you again for discussing this topic. We also stand in support of moving this legislative proposal forward. I understand that there are very strong opinions on both sides of this issue, and I think most importantly, the board needs to focus on what's right for patients. And what's right for patients is getting vaccines into arms, whether that means the COVID vaccine, flu vaccine, or any other routine vaccination. There's been a lot of talk about scary errors that have occurred and unsafe situations and those types of things. I would encourage the board to look at the evidence. So where is the evidence, to Maria's point, that errors have occurred as a result of allowing technicians to immunize? And keep in mind that this is in its infancy since the DCA waiver was just approved recently. If you look historically back to Idaho was the first state that allowed this and has been occurring since 2017. There are published, peer-reviewed, non-biased articles that have been provided to the board by a number of stakeholders that show that this is safe and that there are no safety concerns with technicians doing immunization. So I think ultimately the board needs to think about what's right for the consumer here and what's right for the public, as per the charge of the board. As Mr. Guttis stated from Albertsons, this is not about giving the pharmacists more to do. This is about giving the pharmacists the ability to leverage all of their resources to the most effective situation at the time. More importantly, if the pharmacist is the only person that can do the process end to end, the pharmacist is going to have to do all of this. By allowing technicians to do more, it allows the pharmacist more flexibility to serve the patient in a safe way. If anything, California also needs to look at whether or not they should be expanding the ratio, as it is the most restrictive pharmacist to technician ratio in the country. So I appreciate the discussion on this, but I encourage the board to continue to really think about what's right for the consumers of the state of California, which is to get vaccines into arms. Thank you.
Thanks, Lori.
Our next comment comes from Robert Stein. Robert, your line is open. You will have 2 minutes.
Thank you. I just want to point out the common thread from the folks who've testified against moving forward with this legislation. The common thread is that they work in a corporate environment where expectations of productivity are basically de jour. As a pharmacist, this really bothers me. We are professionals, and we should be able to exercise professional discretion to ensure that our deployment of our technicians, our workflows are not causing danger to patients. So again, it seems that the problem is that we don't speak out enough as professionals, and basically don't. I'm sorry. Obviously, I'm very emotional about this topic. But pharmacists need to push back as professionals and not allow themselves to be forced into situations that are dangerous. Thanks.
Thank you, Robert.
And with that concludes our requests. Oh, one more comment from Eric Robles. Eric, your line, I'm not sure which one is going to work. Your line is open. Eric, can you hear us? Eric, did you want to make a comment?
I'm having.
There you go. We can hear you now.
Oh, great. I'm sorry about that.
It's okay.
I just want to, yesterday in licensing committee, one of our pharmacists testified. I just want to reiterate, we're in this pandemic. There is an emergency waiver in effect, and we're still trying to figure out how that emergency waiver is operating. This legislation is very premature. I understand folks are saying, let's just tee it up and get it ready. But the reality is, we should not be taking advantage of a pandemic. We should not be creating emergency waivers into changing them into state law and making statutes out of them. We should not be changing the policies until we actually know how this waiver worked. And since we're still trying to implement it, it doesn't make sense that we should be trying to move a bill even before a deadline. If this bill makes sense, if the waiver makes sense, then there's room to make this happen in the future. This is not an emergency need in the state of California after the pandemic is over. So I think we should really consider that point. It's that we should not take advantage of the current waiver process and move emergency waivers into existing law. It just shouldn't happen. I think if we did that in other industries, in healthcare, you would understand what kind of fight will be ahead in the future. So it just changes the perception of passing these emergency waivers. And eventually, when you take advantage of these emergency waivers and create law out of them, it puts a lot of distrust into the system. So on behalf of our members at the United Nurses Association of California Union of Healthcare Professionals, I would really hope that you would rethink your position on this initiative.
Thank you, Eric. So, Greg, I think we need to call for a vote, but I want to be clear what the vote is, because even just listening to all the stakeholders, like the last one, I think he actually is in support of the motion, even though he, I think, stated otherwise. The motion is to table for now, moving forward or pursuing a statutory solution until after the workforce survey has been completed. That is the motion from the committee.
Yes.
So
I
could you,
second the motion.
oh, I'm sorry. So thank you, Eric and Greg. I think it's time to call for the vote.
Debbie, can you clarify the committee motion?
Yeah, that's what I was actually just trying to do.
Yeah.
So the committee motion is to table pursuing a statutory solution until after the workforce survey is complete. So the committee is bringing forth that we would not move forward with the statutory solution. Once again, the vote from the committee was 3 for, 2 against, and 1 abstained.
Okay, we ready?
No.
You're opposing.
Yeah, I'm opposed. So the motion currently, as written, is to study this and not put forward a statutory.
Right. Understood. Okay, thank you. No. Okay, Cheryl Butler.
My vote is yes.
Okay. Shirley Kim.
Yes.
Sung Oh.
Yes.
Jig Patel.
No.
Ricardo Sanchez.
Yes.
Maria Serpa.
No.
Debbie Veal.
No.
Jason Weiss.
Abstain.
Albert Wong.
Yes.
Okay, 3, 4, 5. I vote no. So let's see where we are.
I think that ties it. I think it's a tie.
Yeah, looks like we've got 1, 2, 3, 4, 5 no's, 2, 4, 5 yeses, and an abstain. Okay. So
it fails, correct?
if if it's a tie, as far as I know, it fails. Council, is that true?
That's true. It fails. You don't have enough votes to overturn the motion.
Okay. We don't have enough votes to overturn it, or we don't have enough to approve it?
Both, because you've got a 5-5 vote.
Right. So does it fail then? Is what I'm asking.
Yeah, it fails, but there's no other motion that replaces it, so it remains. It's not adopted. It's not rejected.
Right. So does somebody? Okay, that fails. Does somebody want to make a motion, a different motion?
I'd like to make a motion to reject the committee's decision and move towards statutory legislation.
Okay, well, that already failed, so I think you just have to make it to move towards the legislation or to approve moving forward with legislation.
That's what I mean.
Okay,
And this is Debbie, I would second that.
okay. I guess we get more discussion now. Debbie, it's back to you.
I
I don't, Mr. President, I made the motion. Mr. President, I made the motion. I'm not quite.
I'm sorry, Ryan, I spoke over you.
Ryan, what were you going to say?
I don't know. I mean, it's up to you. More discussion. I don't think we need any more discussion, but it's up to you.
Don't, but I think every time we make a motion, we have to allow for it.
Gotcha. Okay. Thanks.
Discussion. And so I guess as the committee chair, I would open it up to board discussion, and we'll go to public. But I guess I would encourage new information. Let's, like Greg said earlier, let's just not like rehash what we've already heard. So if there's someone who hasn't spoken, or if there's a different perspective from anyone, can we open up for that? So is there any of the board members have any kind of a new perspective?
I don't think so. So I think we can go ahead to public.
Public, I think we'll ask you the same thing.
The same thing.
Albert, great. This is Albert. I would like to make a comment before the public.
Okay. This is something new that hasn't been expressed before. Is that correct?
Well, I just want to say that I agree with Dr. Stein and Rob that we are professional. We should have to decide what we want to do. And also Rob said that, he got the policy that no retaliation, and all the pharmacists and technicians have option whether they choose to do or not. But if all those pharmacy out there have policy like that, then I would be happy to see it.
And Mr. President, also one final comment that has not been said, or maybe it has, and I just missed it. This is, it affects the, minority and brown communities the most when you don't have access to these vaccines and shots. The wealthy communities, they go to private doctors and can be seen immediately. And so be careful what we're doing when we vote no to study something, and take a look at who it really hurts. And
thank you.
That's the point. Thanks.
I'd like to make a comment, and that I don't see anything here that would be hurting the Black community. All we're saying is that we want to wait and let this roll out and just see what's happening, and that there's a waiver before we make a statutory proposal. We're not trying to keep any community not taken care of here.
Thank you, Cheryl.
Greg, this is Debbie. I'd like to make just one comment in response to Albert's question about retaliation. I think most corporations have harassment policies, and if I can think even of our own board harassment policies, but I can think of my company's harassment policy includes no retaliation.
And they also have whistleblower policies, I believe.
Right.
Okay.
I think Albert, people are safe in the corporate environment, but.
Well, let's not get into that one.
I don't.
That's not our issue right now. Okay.
Do we, excuse me, Greg? I mean, if it's 5 to 5, can we just leave it? I mean, why do we have to keep going over this?
Well, because somebody made another motion, and we have to deal with the motion.
Okay.
Greg, I wanted to make a comment. This is Jake. I agree with Ryan. Access to minorities is an issue, and what we are trying to achieve here is definitely help access. Thank you.
Thank you.
The saying is, access delayed is access denied.
Right.
So I can't in good conscience move forward without providing that access.
Thank you. We've already done this. Okay.
I can tell. Yeah, thank you. Because
Can
I'm
we
about to
open
say,
it up to the
don't
public
talk
now?
about access.
Okay,
People of
let's
color, I
open
don't
up
know
to the
about that.
public. Thank you.
Moderator, can you please open the Q&A panel? And we do implore the public to please, we're looking for new information. We're not looking to rehash what has already been said.
This is the moderator. We have reopened the Q&A panel. Again, if you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first request comes from Stephen Gray. Stephen, your line is open and you will have 2 minutes.
Thank you very much. As all have said, this is a very, very important topic and a very, very emotional topic and a complicated topic. I would just like to point out something that has not been said. The motion earlier that was a tie had with it that it would wait until after the survey. I believe that from the discussion yesterday, what you're going to hear when you get to the topic about the survey on the agenda is that it has considerable problems and may take quite a long time to resolve. You haven't heard, the rest of the board members haven't heard that yet. And so this particular motion would let us go forward at least into the legislative process. And if there is information that comes back from a survey, a good survey that gives actionable information in a timely manner, that can be incorporated into the arguments for or against the legislation. So I urge board members to take that into consideration, and I look forward to the discussion about the survey later on today. Thank you.
Thank you, Steve.
That was a good comment, and that is when we get to the survey, you will find out that it is not moving forward, that we have more work to do. So thank you for that comment.
Our next comment comes from Paige Talley. Paige, your line is open and you will have 2 minutes.
Okay, thank you. I have 2 comments. One is that earlier there was a comparison of California to Idaho, and I just want to mention that California has 37 plus million people in population, and Idaho has 1+ million people. I think maybe 1.5 million. So there's a big discrepancy there. And also when Eric Robles spoke for UNAC, I believe it was UNAC, it was mentioned that he was probably supporting the motion, but from yesterday's comments by the UNAC representative pharmacist, they opposed the proposal. So I just wanted to make that clear. Thank you.
Yeah, thanks, Paige. I think I did point out that although he said support, that I think I clarified what I thought he meant by support.
Oh, okay. I'm sorry, Ms. Beal. I thought you said he was supporting.
Yeah, but he was supporting the motion, not supporting moving towards statutory change.
Oh, right. Okay, my mistake. Thank you.
Thanks, Paige.
Our next comment comes from Daniel Robinson. Daniel, your line is open. You will have 2 minutes.
Thank you. Daniel Robinson. I'm Dean of the College of Pharmacy at Western University of Health Sciences. So I do not represent all the deans, but I pretty much know that deans and colleges of pharmacy are very much supportive of things that advance the practice of pharmacy in the state of California. I also chair the California Task Force for Advancing Pharmacy Practice, and I'm not speaking on behalf of them because we haven't voted on this issue or discussed it directly. But in advancing pharmacy practice, we need a level of support services that is going to allow pharmacists to advance their practice and take advantage of the fact that they are healthcare providers providing healthcare services. So we need high quality support. We need technician support. We need to be advancing technicians and the assistance of technicians. I'd also like to point out that there's a lot of emotion right now. We're in the middle of a pandemic, and if you speak to any healthcare provider who's involved in this, everybody is stressed beyond their limits. People are reaching out to pharmacy right now because we are part of the solution, and we are part of a permanent solution, not a temporary solution. And every opportunity we have to advance our profession, to extend opportunities for technicians. If we have 40 million people and Idaho has just over 1 million, then we need technicians much more than they do. Thank you very much.
Thank you, Dean Robinson.
And our next comment comes from Eric Robles. Eric, your line is open. You will have 2 minutes.
Hi, Eric Robles. Sorry, I think board member Debbie Veal responded to the question, and I was just happy to clarify our position for UNAC.
And Eric, since you're on, why don't you just clarify it, as opposed to me talking for you?
No, I appreciate it. Thank you, Dan. What I was having issues with my connection, and so there was a misunderstanding on my part on the motion. So we were supportive of the current motion, but ultimately, just to be also very clear, UNAC HCP opposes the proposal at the end of the day to move this to move a bill on this current issue. So I hope that clarifies it, and thank you, board member, for seeing me there.
No problem. Thanks for your comments.
And seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
Yes, please.
Greg, do you want to call for the vote?
Yes. Okay. The motion is to move towards legislation. So, Ryan Brooks.
Yes.
Okay. Cheryl Butler.
No.
Thank you. Shirley Kim.
No.
Thank you. Sung Oh.
No.
Thank you. Jig Patel.
Yes.
Thank you. Ricardo Sanchez.
No.
Okay, thank you. Maria Serpa.
Yes.
Debbie Veal.
Yes.
Jason Weiss.
Abstain.
Thank you. Albert Wong.
No.
I'm a yes. So I guess we're tied again. So
I just suggest, and I guess we just take it back to committee. We'll put it back on the committee agenda. More time will have passed, and perhaps it will change viewpoints one way or another.
That's fine. Okay.
Do you want to take a break? It's been 2 hours, or do you want me to? My last couple items should go fairly fast, but you never know.
Let's take a 10-minute break. Moderator.
We will resume at 10 minutes after 11.
Thank you.
I hear you.
Okay. Do you agree?
Yes.
Ryan Brooks, I'm here.
Okay. Here we go. Ryan, you are here. Okay. Cheryl Butler, are you here? Just a roll call. Cheryl?
Is this being recorded?
Yes.
Hello? Yes.
Okay. Shirley Kim? Shirley? Okay. Sung Oh?
I'm here.
Thank you. Jig Patel?
Here.
Thank you. Ricardo Sanchez.
Here.
Thank you. Maria Serpa.
Here.
Thank you. Debbie Veal.
Here.
Thank you. Jason Weiss.
Here.
Thank you. Albert Wong.
Here.
Thank you. I'll call again for Shirley Kim. Shirley, are you here? Okay, I guess we'll have her announce when she comes back. Okay, go ahead, Debbie.
Okay, I am now moving on to agenda item D, which is discussion and consideration of board's current policy related to the authority for pharmacy technicians. For additional, to determine if inclusion of additional vaccines is appropriate. So based on our last vote, and this is similar to what we determined yesterday, is instead of discussing whether additional vaccines should be added, we came up with a motion to combine this topic with the prior topic, moving the statutory to statutory on the pharmacy technicians being able to just provide vaccines at all. So basically, we voted to combine C and D in the agenda to expand the authority for pharmacy technicians to administer COVID, influenza, to add to that, to also consider the addition of other vaccines for a future meeting. So that was a motion that was made and is a suggestion of the committee to the board. And it was, let's see, the vote was 4-1.
Okay, well, we can't add to something that doesn't exist, right?
I think as far as an agenda item, so I mean, if you remember, the committee actually had voted to move consideration of the technician authority for COVID and influenza to after the workforce survey, or to a later point in time. So I think you actually, since that's...
So this one has to go back to committee like the other one.
Yep. And that, and basically that's what the committee voted. But yes, this would just go. So do you want to just table the motion and just send it back to committee?
I think that's what we should do. Do we need to have a public comment on it?
I think
Council?
we should, but if you could also ask that people keep it short. We know what the, and maybe just new topics, I know, with additional vaccines.
Okay. Well, why don't we open up to the public, since the board is going to just send it back to committee unless we hear something different. Or we'll decide something different based on what we hear.
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the ask field and submit that to all panelists. Our first request comes from Keith Yoshizuka. Keith, your line is open. You will have 2 minutes.
Keith Yoshizuka, president of CSHP, speaking on behalf of CSHP. I look forward to working with the licensing committee to expand the scope of immunizations that technicians would be able to administer. Anyway, so is kind of a moot point. This is going to go back to committee, but I look forward to working with the committee to work on this project. Thank you.
Thank you, Keith.
And I'm not seeing any other requests for comment. Would you like me to close the panel?
Yes, please.
It is closed.
Okay. Debbie, back to you.
Okay. So the next agenda item is agenda item E, which is discussion and consideration of the draft pharmacist workforce survey. Just as background, in response to the sunset issues, the issue of medication errors must be addressed to improve patient health. This issue warrants a study in California where the conditions within pharmacy may be different than on a national level. Consideration should be given to determine if the board or some other entity should receive reports of medication errors to gain better understanding of the scope of the issue and report on the findings. It appears appropriate to conduct a survey on work conditions to ascertain if the conditions in California may be a contributing factor. So during our meeting yesterday, what the members and the stakeholders basically came up with was, one, it was absolutely necessary that the survey needs to be anonymous. Second is, in your materials is a sample or the first draft of the survey, and a couple additional items were determined needed to be added or reviewed, including possibly another question on immunizations, possibly another question around or clarification of if you're management and what your position is, a question around PIC, and then just maybe even looking at the flow of the survey was also pointed out. So the decision was that this is going to go back to the staff, and the staff also collaborated with experts from the Department of Consumer Affairs to, kind of revise it and bring it back to the committee to review at our next meeting. So there's no action item on this at this point. Greg, because there's no action item, do we still ask for public comment, or do we just move on?
I think we need to ask for public comment.
Can we do board comment? I have a question for Debbie.
Sure.
Yeah, yes, please. I'm
Just,
sorry.
just real quick, you mentioned some of the areas where the survey will be adjusted. Is that going to happen in committee? Will I have time to send you some comments? Because I see that most of the questions are related to the outpatient ambulatory arena, and maybe some opportunity to add some options or another that people could put in for not only just acute care, but home infusion, long-term care, all the other practice settings.
Ann, can I ask you to help me answer this question? Is the medication errors focused on outpatient, or are we supposed to also be looking at medication errors and potentially the working conditions in all practice settings?
This is Ann. I think that it's the board survey, and I certainly think you can expand it to, conditions in other areas as well. It was originally crafted, obviously, for community, but I think if the board would like to expand it, it's your decision to do so. It's your survey.
I guess, but we're doing it kind of in response to some questions on sunset. Were the questions around sunset, and not that I agree with you, we could expand it, but just to clarify, were the sunset questions, were those around community, or were those for all practice settings?
I apologize, Debbie. I'll need to pull up the issue specifically. I don't know that it specified medication errors in the outpatient setting specifically, but if I'm remembering, it did talk, I think it maybe referenced, some articles that I believe were focused in the community. If the committees or if the board's agreeable, I'm happy to research it during lunch and respond back.
Please do.
And just to add on from my comment is I'm not requesting that you increase the scope of the survey, just that the survey was limited to certain practice settings. it would be good to include that in the introductory phase of to say that this is community outpatient or limit the practice settings. Thank you.
Oh, okay. Thank you. Thanks for the clarification.
Hi, Greg. I just wanted to let you know for the record that I am here. I think I missed roll call.
Thank you, Shirley. Also, I wanted to ask you, I wanted to clarify, you did vote no on the last measure regarding the tech vaccinations, right?
This is for D or just in general for the second motion?
The second motion.
Yeah, I voted no.
Thank you. One of our other members thought you might have said yes, and I had recorded you as no. So thank you for clarifying.
Welcome.
Okay, go ahead, Debbie. Sorry.
Okay, is there any other board comment on the survey? And if there's any other, if you look at it later and you have any other thoughts, please, share them with Ann or myself, and we will incorporate them. But at this point, the plan is that we're going to, based on the comments we received yesterday, we will slightly modify the survey. And there was also some consideration, some comments from the public yesterday that perhaps we should see if there is an outside agency who could administer the survey for us, because there was a strong desire to make it anonymous, and yet to make sure that people couldn't game the survey, whatever gaming might want to happen. And so we are going to also investigate to see if there's any other options, either options within Department of Consumer Affairs around doing surveys in such a way that they're anonymous, and yet, that, I don't know, maybe a code's given to each individual person, and only with that code can you do the survey, so something like that. So we're not exactly sure what that means, other than we did hear the comments from the public, and that is one of the to-dos in addition to looking at kind of a little bit of revision on the survey questions.
Yeah, Debbie, this is Albert. Yeah, you just said for me. That's what I want to say. Yes. Thank you.
Okay, great. All right, is there any other comments or questions from the board members?
I apologize for Debbie. This is Ann. I
Yes?
apologize for jumping in. I just looked, and the issue specific to Sunset, again, does not speak only to medication errors in the community, but it really, the background information provided in the issue paper speaks more to the community setting.
Okay. And going back to Maria, your comment was not that you wanted to expand the whole survey, it's just kind of the drop-down options at the beginning to identify the practice site. You thought we should add a couple additional practice sites. Is that correct?
No, not specifically. It was more that either in the instructions that it be asking for feedback or for surveys, responses from individuals in certain practice settings, listing them, or to have the first question be, what is your practice setting? And if they click long-term care, then it would say, thank you for your response, and they would have no more questions, something like that.
Okay.
Is it the survey sent out to all licensees or just certain places?
I think, Albert, our thought with deployment, we don't have that exactly figured out, but what we discussed yesterday is that we'd probably send it out through listserv, so it'd be everybody who has an email that has registered with the Board of Pharmacy. But then once again, we want to make it anonymous and try to, control the process. So exactly how we do that is to be determined. But our intent is to try to send it out to as many people as we can, to try to get as much feedback as we can.
Okay.
Because it is a good opportunity you know, it could provide some great value if we do it correctly. All right, moderator, can you please open the question and answer panel for the public?
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and send that to all panelists. We will pause for a brief moment, and our first request for comment comes from Paige Talley. Paige, your line is open and you will have 2 minutes.
Okay, thank you, moderator. Paige Talley with the California Council for the Advancement of Pharmacy. I want to thank Dr. Serpa for saying community outpatient pharmacy, because as far as I know, there are only, well, there's probably more pharmacy licenses now with remote pharmacy and sterile compounding license, but the main licenses are hospital and community, and then long-term care is never called out from that. So what Dr. Serpa said was community outpatient, and I think it's important to make that distinction, community outpatient and community inpatient, because there are many, many inpatient situations that aren't necessarily considered long-term care. Thank you.
Thanks, Paige.
Our next comment comes from Stephen Gray. Stephen, your line is open and you will have 2 minutes.
Thank you very much. Just for the education of some of the public members, I served as the support services director for all of Kaiser Permanente pharmacies for about 15 years. And that included virtually every department, including drug information, research, and all things. I have a lot of experience overseeing surveys and working with specialists in surveys, PhDs in surveys. We had 2 PhDs in our department just to do drug evaluations and so forth. And I just want to emphasize that the survey should be kept as simple as possible. And I would say that if the board is really interested at this time in outpatient pharmacy, community pharmacies, not by license type, not by PHY versus HSP. It needs to be, as was mentioned, very clear which community pharmacy. Getting into all the other practice sites gets very much complicates what information you're going to get and what information is available. The second thing to remind all the boards, you need to ask yourself, is this an opinion survey or is this a fact survey? And that will make a difference on how you develop the survey, the questions you ask, and what you're looking for in terms of actionable information. And then the other thing is that if you're talking about errors, there is no law in California that pharmacies have to report errors to the Board of Pharmacy. All the quality assurance law basically says they have to keep track of errors that have actually left the jurisdiction of the pharmacy. In other words, it's not near misses, it's actually errors. And all pharmacies should have that data, but they only have to keep it for like 1 year. Many of them keep it for longer. So it's very important to ask for information if you want facts, and ask for actual facts to come out of the data. You know, the other thing the board gets is complaints. Complaints on errors are very few.
10 seconds.
In the single percent of the actual errors, so you can't go by complaints and you can't go by reported settlements in terms of actual error rates. And this needs to be taken into consideration by the committee. Thank you.
Thanks, Steve.
Seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Okay, I'm going to move on to agenda item F, which was actually was withdrawn, and so I'm going to move on to agenda item G, which is review and discussion of licensing statistics. I think if you look in the board material, there is ample information, spreadsheets, charts in regards to the licensing statistics. And there's also information on processing times. You know, just wanting to acknowledge that our staff continues to work very hard and tries to make adjustments to review applications and mail in as efficient manner as possible during the pandemic, which causes them not to always be in the office or very seldom to be in the office. So that does obviously impact processing times, but they've made a great effort to try to keep them as normalized as we possibly can. Let's see, I guess, is there any board comment on any of the licensing statistics or processing time? Hearing none, moderator, can you please open the question and answer panel to see if there's any public comment on our licensing statistics?
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment on licensing statistics, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. Seeing no requests, would you like me to close the panel?
Yes, I would.
It is closed.
And then the very last item is just a call out of future committee meeting dates, April 21st, July 14th, October 27th, all in the year of 2021. We look forward to the continued support of the stakeholders and appreciate the work of both the committee members and the stakeholders around licensing for the board. With that,
Debbie,
Debbie, yes.
Can I make one last comment on the survey before we're closing?
As long as it's something new and different, Albert.
Yeah, I just want all the licensees out there know that it's very important for them to participate on the survey. This is the chance to speak up to let all the board members know what's going on out there. Thank you.
Okay, thank you. And more to come on how you can participate. All right, Mr. President, our committee report is now submitted. And I don't know if you're on mute, but I don't hear you.
Sorry, thank you. Great job. Now we'll move on. I will now turn the meeting over to Maria Serpa, Chairperson of the Enforcement and Compounding Committee, for her report. Maria, it's all yours.
Thank you. Members, I would like to draw your attention to the Enforcement and Compounding Committee's report and attachments from our meeting last week on January 20th. The first item for discussion is presentation on Pharmacist Recovery Program. At the last Enforcement Committee meeting, we received a presentation on the Pharmacist Recovery Program by Virginia Matthews. She is the project manager for Maximus California Health Professionals Recovery Program. The PRP program is established to rehabilitate pharmacists and intern pharmacists whose competency may be impaired due to the abuse of alcohol, drug use, or mental illness. The statute also provides that the intent of the program is to return pharmacists and interns to the practice of pharmacy in a manner that will not endanger the public health and safety. Consistent with the provisions of the statute, the board contracts with a qualified vendor to administer the program. Their current contract is with Maximus Incorporated. I encourage all board members and members of the public to view the presentation on the board's website. The presentation was via webinar and is available on the board's website. The presentation was an excellent review. It was very educational and informative. It was very well received. This item is informational and has no action. And so I'm ready to ask the members if they have any questions or comments.
Only that I concur, it was a great presentation.
Thank you. I think we're ready for public comment.
Okay. Moderator, please open the lines.
We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon at the bottom of your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. Our first comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you. I'm speaking on behalf of CSHP, the California Society of Health System Pharmacists. As I mentioned at the committee meeting, CSHP again encourages the board to support making the recovery program open to licensed pharmacy technicians. It's currently only available to pharmacists and student pharmacists, meaning intern licensed individuals. Since there has been traditionally a problem, some would say a disproportionate problem regarding compliance and other issues related to the recovery program in the pharmacy technician category. And because more and more we depend on pharmacy technicians and more they're putting a lot of training and experience into their profession, we encourage that that the board support opening this program up, which is a very valuable program, to the public for safety and for investment reasons. We encourage opening it up to also licensed pharmacy technicians. Thank you.
Thank you, Dr. Gray. I think that that's something that will be on a future committee meeting agenda so that we can determine the scope and if statutory changes would be required to accommodate something like that. But thank you for those great comments.
Seeing no additional requests for comment, would you like me to close the Q&A panel?
Yes, thank you.
It is closed.
As I stated, this item is for informational purposes only and has no action. The next item on the agenda is B, discussion and consideration of board policy related to transparency involving the issuance of citations and fines. This next agenda item is a continuation of an issue originally discussed in 2018 related to the board's disclosure policy for citations and fines. The history of the prior discussion and the discussion from last week's committee meeting is detailed in the committee's report. During the committee's discussion, we reviewed the policy questions on the next slide. Is there a next slide? Moderator,
is there another slide?
No, I apologize. That slide was removed from today's slide deck.
That's not a problem. Just to let you know that we, as a committee, to help direct some of our discussions, we had bullet point type of questions. And so the committee discussed this issue, reviewing policy questions that was presented in advance. The committee discussed the routine citations and fines that come up during routine inspections or investigations of complaints that do not merit discipline and are not posted, but only available upon request. The committee also received public comment indicating that the board's current policy is appropriate. The committee decided to maintain our current policy, so we have no action on this item. Oh, there it is. Those are the questions that we considered during our discussion for your information. As I stated, we have no action, but I'm ready for member comment.
Okay, hearing none, let's open up to public comment.
Thank you.
This is the moderator. We have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first comment comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Great. Thank you, Paige Talley with the California Council for the Advancement of Pharmacy. I just need some clarification. At the meeting on the 20th, I believe, Ms. Sodergren indicated that this will be included in the sunset bill, but I'm not sure what that meant. So if she could clarify for me, that would be great.
Certainly, Anne.
Yeah, so this is Anne. So I believe that what Ms. Talley is referring to is the board does have a statutory proposal that will amend the section of the statute specific to citation and fines to clarify that it does not constitute discipline, which I believe is separate than the issue of the policy of whether or not you're posting, whether or not you post the citations, which I believe is the policy goal. But the sunset is specific to a statutory change that would specify that a citation is not discipline.
Thank you. Paige, did you have any follow-up?
No, I just am appreciative of the clarification. Thank you.
Thank you.
And seeing no additional requests, would you like me to close the panel?
Please do. Thank you.
It is closed.
As I stated, this item has no action. So we'll move on to C, discussion and consideration of proposed revisions to self-assessment forms. As indicated in the meeting materials, the committee reviewed several proposed edits to the self-assessment forms required under pharmacy law. The self-assessment process is intended to be an educational and self-monitoring tool for licensees to evaluate for compliance. As mentioned in the meeting materials, current self-assessment forms are in various stages of review and regulatory promulgation. To avoid confusion, the committee decided not to discuss wholesaler and ADDS self-assessments at this meeting. So we did not discuss items what you see on the screen D and E. We will wait for the completion of the current review process before adding additional changes. To help everyone follow along, the self-assessment forms proposed are an attachment 2 in the committee's report. The first assessment under consideration is A, on your screen you see there, is community pharmacy hospital outpatient self-assessment. The changes are detailed in the meeting material, and the next slide is a summary. Is there another slide? Thank you. The committee recommends to the board to accept the updated community pharmacy hospital outpatient self-assessment form with corrections as noted. That's our motion. Is there any member comment? Hearing none, I think we're ready for public comment.
This is the moderator. We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on the screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists.
Seeing no comment,
I will close the panel.
Mr. President, we're ready for a vote on community pharmacy hospital outpatient self-assessment form.
Great. Okay. We'll start with Ryan Brooks.
Yes.
Thank you. Cheryl Butler.
Yes.
Thank you. Shirley Kim.
Yes.
Thank you. Sung Oh.
Yes.
Thank you. Jig Patel.
Yes.
Thank you. Ricardo Sanchez.
Yes.
Thank you. Maria Serpa.
Yes.
Thank you. Debbie Veal.
Yes.
Thank you. Jason Weiss.
Yes.
Thank you. Albert Wong.
Yes.
Thank you. I vote yes. Motion passes. Back to you, Maria. Thank you.
Thank you. The next self-assessment for our review is listed as B, community pharmacy and hospital outpatient pharmacy compounding self-assessment. The committee discussed this new form to replace the current version of the self-assessment form, the 2012 version. This new proposed one is included in the meeting materials. When the board updated its compounding regulations in 2017, the self-assessment form was not included in the rulemaking at that time, and no subsequent rulemaking was pursued to update the self-assessment forms to reflect the changes that took effect at that time. Since new regulations took effect both in the 2012 version and the draft 2016 version has been available online. So members, this is essentially a new form. It's a repeal and replace, which I think, there you are. And so that is in your meeting materials as a completely new form. So the committee's motion is to recommend to the board to initiate the rulemaking process to update community pharmacy and hospital outpatient pharmacy compounding self-assessment form. Since it's a committee motion, we're ready for member comment. Hearing none, I think we're ready for public comment.
Okay, moderator, please open up the lines.
We have opened the Q&A panel. If you'd like to make a public comment, please click on the Q&A icon on your screen. Type, I would like to make a comment into the ask field and submit that to all panelists. Our first request comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Okay, thank you. I just want to clarify again, and I'm sorry for having to do this, but that during the meeting I had mentioned that there was a discrepancy between regulation and the assessment forms. It's 1751.4K on the room temperature. So that will that be amended before you begin the rule processing, or do you want to wait until public comment? Is that, or has it changed and I just didn't see it?
No, thank you for bringing that, Ms. Talley. I know that you mentioned that at last week's meeting, and at the time we said we would assure that the self-assessment form matched current regulations. So I'd ask staff, has that determination been made yet, or is that something that's coming in soon?
It's something that's coming soon. I think we see 2 different versions, so we're trying to get clarification.
So I guess the response would be to maybe add to the motion that, let's see, with any correction required to match current regulation. So if that's okay with the committee or with the committee, can we go ahead and change our committee motion to allow for any minor corrections to assure matches current regulation?
Council?
So, actually, I'm asking the committee members.
Oh, okay.
Committee members, are you okay with us changing the motion?
Yeah.
Represent the full board?
This is Ryan Brooks. I think it's a good motion and practical, so yes.
Yes, Maria, this is Jake.
This is Debbie, yes.
So I guess now, thank you, Greg. I think the question will be for council. Since we do have committee members agreeing with changing the motion, do I need a second at this time?
At this point, yeah. If we have a first and a second, and then we have the committees, because it's a new motion for the committee.
Yeah, so we are changing the committee's motion. So I will move that we change the committee's motion to include any minor corrections as needed to match current regulations. I guess I need a second.
I'll second.
Thank you. Members, any further comments? I guess we have to take public comment one more time.
Mm-hmm. Correct.
This is the moderator. The Q&A panel continues to be open. If we have any further requests for public comment, you can submit them now. And Paige Talley, your line is open. You will have 2 minutes.
Yes, I'll only take a second. I just want to say thank you for making that adjustment.
Thank you for the reminder. I appreciate that, Paige.
Sure, thank you.
And our next request for comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Yeah, just a quick comment. It was confirmed in the committee that all of these have to go through the regulation adoption process. And typically, the motions include authority for the executive officer to make corrections before they go through that process. And so I'm not sure this is really necessary, but I just wanted to point out that there will be a time because they go through the regulation process for the public and interested parties to also make comment during that public comment period. Thank you.
Yeah, thank you, Dr. Gray. That's true. This is not the first time or the last time we'll be seeing these self-assessments.
Seeing no additional requests, would you like me to close the panel?
Please do. Thank you. Mr. President, we're ready for the vote.
Great. Ryan Brooks?
Yes.
Thank you. Cheryl Butler?
Yes.
Thank you. Shirley Kim?
Yes.
Thank you. Sung Ho?
Yes.
Thank you. Jig Patel?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Debbie Veal?
Yes.
Thank you. Jason Weiss?
Yes.
Thank you. Albert Wong?
Yes.
Thank you. I vote yes. The motion passes. Back to you, Maria.
Thank you. The next self-assessment for our review is noted as C on the agenda, hospital pharmacy self-assessment. The changes are detailed in the meeting materials, and there's a summary slide that goes with that. So you can catch up with that. Are you able to change the slide? There you go. So that's the summary slide of the changes that were incorporated into the hospital pharmacy self-assessment. The committee recommends to the board to a motion to accept the updated hospital pharmacy self-assessment form with the corrections as noted. Members, do you have any comments? I think we're ready for public comment.
This is the moderator. We have opened the Q&A panel. Again, if you'd like to make a comment, please click on the Q&A icon on the screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. Our first request comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you very much. I believe that this will be unanimously supported also, and I certainly do support that. I want to comment that, first of all, these are very valuable documents, and we use them in teaching pharmacy and law and ethics and teaching students to prepare for the law exam and, more importantly, for practice, and they're used extensively. However, I presume that the board policy will say that until these versions are adopted officially through the regulatory process, the ones that have to be submitted and signed will still be the previous versions, but the board will encourage all PICs and all other interested parties to use these pending self-assessment forms as a valuable checklist for their practice and their environment. And I would like to get a comment back if the board anticipates some other process that it has followed other than what it has followed for the last pending self-assessment forms. Thank you.
Thank you, Dr. Gray. As you stated, that is the current policy of the board, and that we post not only the current self-assessment, but the pending self-assessments. And board staff, would you like to comment on that? I know that that's on the website.
Yes, so we do encourage, but we cannot require the use of the draft. And typically we're indicating that we believe that the self-assessment form is more meaningful if they use the more updated draft as it goes through the rulemaking. I think ideally we're going to get all of these self-assessment forms current and we won't have this challenge moving forward, but our past practice has been we provide both, and we encourage use of the more updated, but we do not require it.
Thank you. I know that's also included in the reminder to licensees when it comes time to do the self-assessment forms, that practice and policy is included in the reminder. So as a last component of this section, oh, sorry.
Seeing no further questions. Yeah, that's okay. We have no further requests. I will close the panel.
Thank you. Mr. President, we're ready for the vote.
Okay, thank you. Ryan Brooks?
Yes.
Thank you. Cheryl Butler?
Yes.
Thank you. Shirley Kim?
Yes.
Thank you. Sung Ho? Thank you. Jig Patel?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Maria Serpa?
Yes.
Thank you. Debbie Veal?
Yes.
Thank you. Jason Weiss?
Yes.
Thank you. Albert Wong?
Yes.
Thank you. I vote yes. Motion passes. Please go ahead, Maria.
Thank you. As a reminder, we will not be discussing the last two self-assessment forms at this meeting. We will wait for the completion of the current regulatory review before adding additional changes. Additionally, during our meeting, members also contemplated if changes to all self-assessment forms, the self-assessment process, may be appropriate. Perhaps using an online interactive format versus the current static PDF format. Our committee believes that this should be agendized for future discussion and suggests that this may be more appropriate for the Communications and Education Committee. So that's just informational for the president. A suggestion to add to the agenda for Communication and Education Committee policy on self-assessment process.
Thank you. Anne, can we go ahead and do that, please?
I apologize. One more time.
Can we go ahead and do what Maria just asked you to do, asked us to do, to transfer to the other committee?
To agendize the self-assessment process to the Communications and Education Committee.
Yeah, so the process itself is different than the forms that we're reviewing that are required by law. And Greg, I believe that it's your discretion to determine which committee is going to complete the public discussion.
Okay, well, I'm good with what Maria recommended.
Okay.
Okay. Thank you. Okay, let's go on.
Okay, the next item on the agenda is D, discussion and consideration of proposal to develop an alternative enforcement model. The committee and members of the public continue to have a robust discussion on the potential of an alternative enforcement model to reduce time and cost associated with resolving a disciplinary matter. The administrative case process has two fundamental guiding principles: due process of the respondent and public protection. On the next slide, that could come up, we use these questions to help lead the discussion. Thank you. The committee reviewed the materials provided to the board in your attachment 3 of the committee report. This is the memo provided by counsel, Ms. Smiley, and the proposal from CPHA to previous language that is no longer under consideration. We also talked about the importance to make a decision based on data as opposed to responding to anecdotal information. It appears that any suggestion for change will require a statute, or we require a change in statute and legislation. After another lively discussion with committee members and members of the public, the committee has no motion for the board. We have directed staff to look at non-legislative options available to meet policy goals. We should determine if other considerations are effective before working on a legislative process that will require significant board time to sponsor and move forward. The committee will continue to evaluate and study this issue. I'm ready for member comment.
Hearing none, let's move it on to public comment.
Before we start with public comment, I have a couple of statements.
Sure.
As we open up for public comment, I would like to ask the members of the public to refrain from speaking on case-specific information. This is in part to preserve the board's authority to act on pending matters in the future. Further, I caution board members that at times we receive public comments that reflect an individual's opinion of events that may not be consistent with the public record on the matter. Thank you. I think we're ready for public comment.
Thank you, Maria.
We have opened the Q&A panel. Again, if you'd like to make a public comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the Ask field and submit that to all panelists. At this time, our first request is from Daniel Martinez. Danny, your line is open and you will have 2 minutes.
Thank you, moderator. Danny Martinez with the California Pharmacists Association. I'll start off by saying this has been an incredibly frustrating topic to discuss with the committee. A year ago, almost to the day, we were so close to getting this done. And it seems that since then, we've just been drifting further and further away from seeking an answer. At the last full board meeting, I was directed by the board to come back to the next committee meeting and present on an item to discuss this. And that's essentially what I tried to do. Unfortunately, I was only given an opportunity for a 2-minute public comment period to explain kind of what our proposal is, and without really any sort of context for the committee. So having said all that, I do wish to move forward on this, and I hope that perhaps even at the next committee meeting or at an appropriate time, since I know the next committee meeting has other topics that we're going to be discussing, I really like an opportunity to actually present what we were going to present at this last meeting. So I appreciate the opportunity to make these comments. Thank you.
Thank you. Just to clarify, CPHA did provide a PowerPoint presentation, and the final slide was a proposal. Unfortunately, their proposal was based on other proposed regulatory changes that were no longer in play. So that did cause confusion during the committee meeting and testimony. And we asked Mr. Martinez and CPHA to come back with a proposal that's based on current regulatory language, such that we could follow along. The other proposal from last year is no longer applicable. So making changes to a proposal that's no longer applicable was kind of confusing. And so we have agreed and accepted that Mr. Martinez and CPHA will be providing some testimony at the next committee meeting as we continue this very complex discussion. Mr. Martinez, since I did talk a lot after your statement, I wanted to give you a moment to respond if you had anything to say about my comments.
No, other than that, I mean, I guess we're in a little bit of disagreement. This is a complicated issue, and I won't belabor that here because I know that there's a lot of other things that we need to discuss, and I'll just save that for the next meeting. All I'll say is that I think, frankly, we've been very clear on what it is we're trying to get enacted, and I hope that at the next committee I'll have an opportunity to further discuss that.
Great, thank you.
Our next comment comes from Paige Talley. Paige, your line is open. You will have 2 minutes.
Thank you. Paige Talley with CCAP. And I simply want to say that I think this is an important issue and does need to be continually discussed. And so thank you for Dr. Serpa for putting it back to your committee and as an agenda item.
Thank you, Ms. Talley.
Our next comment comes from Stephen Gray. Stephen, your line is open and you will have 2 minutes.
Thank you very much. This is Stephen Gray on behalf of CSHP. First of all, again, I would like to compliment CPHA on their long process for this. It's gone on for several years. And because it's gone on for several years, there's a lot of information that may not be, with which the current board members may not be familiar. And that always, as things drag out, always makes things more complicated. One of the things that was not mentioned, I believe, was that the committee asked the staff to also look at what other California boards have done with alternative processes. So, you know, such alternative processes, perhaps with legislative or regulatory changes, are possible, and also to look at both the benefits and the potential problems of alternative processes that are done in many other state boards of pharmacy that are significantly different from what the traditional process has been for formal discipline. We're not talking cites and fines here, but for formal discipline here in California. And so we also at CSHP look forward to a vigorous discussion of the alternatives because we believe that there is significant feelings and probably good evidence that in some cases due process is not necessarily being lived up to the highest standards. And fairness is so important to gaining the trust of the practitioners and the public, as we all know, in our due process throughout the justice system. Thank you very much.
Thank you, Dr. Gray.
And seeing no additional requests, would you like me to close the panel?
Thank you.
It is closed.
We'll move on to the next agenda item. Discussion and consideration of discrepancies between the state and federal controlled substances and its impact on health services. Members, the meeting materials provide a history of the board's recent policy discussion on this issue, including prior legislative efforts. As discrepancies remain between the state and federal schedules, the committee considered if additional efforts should be undertaken to synchronize or otherwise address the discrepancies. We use the information on the next slide to lead our discussion. Thank you. We ended our discussion with a decision to focus solely on the four most troublesome drugs. That's Fioricet, Donatol, Librax, and chlordiazepoxide, which are not on the same schedules on the state and federal controlled substances. During public comment, it was suggested that the board consider using schedules for different purposes, using state schedules for criminal matters and federal schedule for medical purposes. The committee decided not to pursue any policy changes, but only to look at the four specific drugs that I mentioned. And just to repeat, that is in the materials, but just for everyone to know, it's Fioricet, Donatol, Librax, and chlordiazepoxide. So our committee's motion is to recommend to the board that California match the federal schedule for these four identified drugs, and that this would require legislative authority. Since it is a board motion, we're ready for member comment. Hearing none, I think we can go on to public comment.
This is the moderator, and we have opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen, type "I would like to make a comment" into the Ask field, and submit that to all panelists. Our first question or comment comes from Stephen Gray. Stephen, your line is open. You will have 2 minutes.
Thank you very much. This has been a long-standing issue, and to remind the board and some of the new board members that this became an issue with the submissions to cures, and that was cured by changing the regulation to say that the federal controlled substance document regulations required using the federal schedule for submissions to cures. This action by the board will help with that difference if it gets through the legislature, which it has to do because of, the schedules are actually in the statutes. I just would point out that there's one additional misalignment that the committee didn't discuss and the board may want to consider, and that is that in the federal schedule, there's a difference between the state schedule and the federal schedule for buprenorphine. Buprenorphine is Schedule 5 in California, and it's in a much more restrictive schedule. I believe it's in Schedule 3 in the federal schedule, 3 or 4. So that also may want to be added to the motion. Thank you.
Thank you, Dr. Gray.
And seeing no further requests, would you like me to close the panel?
Please do. And I guess just to clarify, we were focusing on the 4 drugs that are unscheduled in the federal schedule and are scheduled in California. We weren't looking at disparities between the different schedules between the federal and the state. We decided that was more of a complex issue, and so we're only looking at schedule let me go back and look at my motion here. Looking at these 4 identified drugs and matching to the federal schedule, which would make them the same. And once again, it's because the federal schedule has these as exempt and in state is not, if that makes things a little bit more clear. So that's why we only pose these 4 and not actually any policy changes or any other drugs. So the motion that is is currently on discussion is just for these 4 identified drugs. And so I would, unless
We lost you. Are you still there?
that clarifying nature, I think we're ready for the vote.
Okay, so again, the vote would be to remove.
Sorry, can you hear me?
So the vote would be to remove these 4 drugs from the controlled schedule,
So,
correct?
no,
Greg, it's Ann. Oh, sorry.
To synchronize the schedules?
To match the federal schedule.
Hi, Maria, you're cutting
Okay,
in and out.
you're cutting in and out. Okay, but the
believe-
motion
yeah.
is to match the federal schedule on these 4 drugs.
Right. We would need to pursue a statutory change
Oh,
for California to match the federal for the 4 drugs described.
okay. So our motion is to pursue a statutory change
Yeah.
to match the schedules on these 4 drugs. All right, let's vote. Ryan Brooks?
Yes.
Okay, Cheryl Butler?
Yes.
That is correct.
Thank you. Shirley Kim?
Yes.
Thank you. Sung Oh?
Yes.
Thank you. Jake Patel?
Yes.
Thank you. Ricardo Sanchez?
Yes.
Thank you. Maria Serpa? I know you're a yes, but I'm not hearing you right now.
Yes.
Okay. Thank you. Okay. Debbie Veal?
Yes.
Thank you. Jason Weiss?
Abstain?
Abstain. Okay. Albert Wong?
Yes.
Thank you. I vote yes. The motion passes. Maria, it's back to you. Are you able
Can you hear me now?
Yeah, we can now. You keep going in and out. Well, I'll tell you what.
Maybe in light of the technology.
Yeah, it's 12:12. Why don't we take a lunch break and maybe you can get that corrected to move on afterwards. So let's take a 45-minute lunch break. Let's come back at 1
Great.
o'clock.
Thank you.
Okay, moderator, we'll be on lunch break until 1 o'clock.
Will do. Thank you.
Thank you.
So I'm going to stay on. Moderator, this is Maria. Can you hear me
Yes.
now, or should I
I can hear you, but you keep cutting in and out mid-sentence, so maybe let's try and have you log back in. I know we have
Hang on. You can hear me better now?
Try again. Yeah, I can't hear you. You're still cutting out. So I know we have another weather system rolling through the area, so maybe log out and try and log back in. We'll see if that resolves it.
Hi, moderator. What time are we getting back in?
Okay. If not, I can go on to
1
my
o'clock.
thoughts.